Dr. Matt here from LifeWorks Integrative Health. Now this is one of the last videos that we have in our series of our knee pain videos, how to prevent knee replacements and be proactive with your knees and joint pain so we don't end up with arthritis in our knees. Now, we've talked about a lot of things here on these videos. We've talked about the normal anatomy, we've talked about the structure of the knee, we've talked about the muscles and where normal muscles are, and then when they imbalance, how it rotates the joints, increasing wear and tear within that joint tissue and really starts this degenerative process. We've talked about our standard medical care when it goes from NSAIDs, maybe even opioids to decrease the pain, down to cortisone, down to surgery, and how these aren't ever getting to the root cause of the problem. Now, we've also talked a little bit about how we change that protocol and how we work on addressing the root cause of the problem. And on this video, I want to talk more specifically about the last step that we use with our patients, which is regenerative medicine and regenerative therapy. So if we look at the steps that we go through, one, we want to start to brace that joint. So we brace the joint in order to unload the pressure off of the area that is degenerated, okay? Once we unload that joint, then what we're going to do is our medical team will put what's called hyaluronic acid into that joint, and it's going to help to lubricate that joint over time. Some of you guys may have had this. Some of you guys may have had it and just only did that alone. Well, there's a challenge with only doing the hyaluronic acid alone. You're lubricating a joint that has dysfunction on it. So essentially, it's still going to wear down, it's still going to break down over time, but it may help with some of the pain. So to have a more complete picture of the knee, a more complete protocol and treatment, you want to correct the muscle imbalances. So balancing the muscles is our third component of restoring the knee and restoring the joint. Once those muscles become stronger or not as tight, we can start to align that knee properly, and then that's our fourth component, is aligning the knee so that the wear and tear isn't happening on the knee nearly as fast or at all. Once we get those basic things handled, then it comes down to strengthening and stabilizing that knee and increasing the muscle strength through the upper part of the leg, the lower part of the leg, and through the glutes and the buttocks, okay? In fact, if you've been watching the other videos, you understand that a huge component to why people have knee pain today is not traumas, okay? Only about 10 to 20% of the people that have knee pain can tie it back to an actual trauma that they had to their knee. The other 80% is wear and tear. And what starts to create this wear and tear is what's called glute amnesia. Your glutes not working properly, essentially, okay? They're not firing, which creates tight muscles in other places. So by us balancing those muscles and then stabilizing those, we help to reduce any wear and tear and correct the biomechanics. This is a huge missing component that happens with people with knee pain. We just cover it up with cortisone, cover it up with medication, and it breaks down over time. Now, what if you already have arthritis inside of your knee or inside of your shoulder or hip, wherever it may be, okay? The challenge that we had years ago was that once that damage was there, we can never regenerate that tissue. Now, with the technologies we have with regenerative medicine, we have the ability to regenerate tissue. And that's kind of the last step that we do with our patients, is help that tissue begin to regenerate on the inside. And we do that through regenerative medicine. I'm not sure if you can see that here. So it's our Regen Med program. And there's two types of regenerative medicine that we use. We use one that's called stem cell therapy. Maybe you can see that better now. So it's stem cells, and what stem cells will do is they have three main characteristics. They'll help decrease inflammation, they'll help balance an immune system, but then what they also do is they regenerate tissue. And they've shown to be very successful at regenerating that tissue within the joint and helping people with chronic pain, and then really help to balance out all of what we're doing up here long term. Now, for those of you that aren't as far progressed in the degenerative stage, we can also use PRP, and we'll a lot of times use this on the younger population or as a booster for stem cells. And the reason why is because typically the younger population isn't going to have as much degeneration on those joints. And so this is the path that we follow for people that have knee pain, that want to avoid surgery, and really getting to the root cause of the problem. So I hope you've enjoyed this series of watching all of these knee pain videos. I kept them short so that you can get through them real quickly. There's one more we're gonna go over yet, and the next video we're gonna actually go over what a normal and an abnormal knee looks like on x-ray.